So he was 14 months old, and I was upstairs getting ready, and my husband was downstairs doing breakfast, and I just heard the most awful scream I've ever heard in my life. And he had sort of grabbed the tablecloth and pulled the teapot, and the teapot had gone all over his chest and his legs. And it was strangely weird because I just sort of went, oh, should we go to the doctor? I just didn't have any idea. I had absolutely no idea what was going on. But then I realised how bad it was, so I rang an ambulance, and then the ambulance came really quickly. It was when I was waiting for the ambulance, when we were waiting for the ambulance, that I realised quite how bad it was, because he just wouldn't stop screaming, and he was screaming and screaming. And the ambulance came and basically took one look at him and asked us to get some cling film, which they put over him, wrapped him up in a towel and bundled us off, and off we went. We went to A&E, and actually that's one of my worst memories. I remember coming out of the ambulance and walking round the corner into A&E, and there was just this rank of people waiting for me, and I realised at that moment actually he was really badly hurt, and I hadn't known until then, and that was when it kind of hit me then that it was bad.
There were people.
Yeah, there was literally like 10 people waiting for me, and suddenly all firing questions at me, and that was hideous. Yeah. I think we were there a couple of hours because the burns team were there immediately, and so like the doctors and nurses were obviously, I don't even know what they were doing. I suppose they were trying to give him pain relief. And then the burns team were there, and they were asking questions obviously about how it happened, and saying that he would probably need to have an operation. And then I remember they put like the bear hugger blanket on him, because obviously he was really cold, where we put him under the tap to rinse off the burn, and he sort of fell asleep on me. And so he must have been an hour or so in A&E, and then they took us down to the children's department. They explained that they needed to clean it. And they were going to try, I can't even remember what it's called anymore, this dressing. BioBrain, that was it. They were going to put BioBrain on it, and that he would need a general anaesthetic, which obviously we just said yes to. But they took us down to the children's ward, and we were there a while. We had a room. I remember we watched some telly, and it just seemed really surreal because he was okay. He had the cling film on his tummy and his leg, and he was kind of his normal self almost, watching a bit of telly and just kind of playing with us.
So she seemed quite comfortable.
He seemed all right. I knew he wasn't, and then we knew he was going to go down to surgery, and I don't even remember how long we were there. I remember at one point I rang work. I did the most weirdest things. I was like ringing work going, he's had a burn, I'll be off for a day or two. I just still didn't, it was like really surreal. It was not, I can't even explain it. It was like it wasn't even happening. The nurses were lovely, because I suddenly realised that I had the most pounding headache and I was really thirsty, and they gave me some paracetamol, which was nice. And it was nice to be in a room, not to be on the ward, because at least I sort of looking back now, I can sort of see why that was, because they were probably worried it might get dirty or infected. But it was nice to be away from the hustle and bustle. And the nurses were lovely, and then off he went for surgery. But I got given a lot of leaflets right at that moment, which I just went, ugh. It was just, and I kind of read the one about the BioBrain, and I thought, this sounds good. It'll be left with only something % of scarring. But and then there was one about caring for the scar, and there was another one about skin grafts. I was like, I don't need to read that. That's not going to happen. I don't need to read that. So I just had this big pack of leaflets that I just kind of put away to one side. They did explain about, I do remember they explained they needed to clean it, they needed to thoroughly clean it, and for that he needed to be asleep because it would be painful. So I understood that, and that they would apply this BioBrain and then they would see how it worked. I can't remember whether they said he might need skin grafts. They probably did, but I've no idea. Like, I don't know if it would have helped if they'd given me any more information, because I was in such shock. I couldn't have taken any more in, and actually they gave me this big wad of leaflets, which I did keep, but I was just like, there was no way I was going to be able to read them. So we knew he needed surgery, and we hoped that it would heal, miraculously heal his burns. He came back to, no, he wasn't on the ward, he was in a little room, and actually I think that was the high dependency room because it had a big window that looked out over the nurses' station.
Right.
And he stayed there for the night, and I was in with him, because I stayed with him the whole time. And he was there one night, and then we moved to, obviously they needed to put someone else in there, which was fine, and we moved to another little room around the corner. So we weren't on the ward at any time. We were always in a room. Every single dressing change is scarred into my brain as the most hideous time. Because he was scared. And he was in pain. And I always think, if he'd been an adult, he would have said stop. But he couldn't, because he's only a little boy. And sometimes I felt like the doctors and the nurses had the kind of mentality, well, just do it quick, or just get it over with, because he won't remember. Because he won't remember this. And it's true, he doesn't remember it. And a couple of hours later, he was fine. But for that, oh God, I don't even know how long dressing changes took. They felt to me like they took forever. For that time when they were taking the dressings off and then having to look at the scar and then put new dressings on, it was the worst times. Those were some of the worst times I've ever had. And you could just tell he was in pain, and he did for some of the dressing changes have sedation, which kind of worked and kind of didn't. And I can't remember whether he had any pain relief. I'm sure he must have done. I'm sure he must have done. But I always felt like, if it had been me and that dressing change was happening to me, I would have said no. Don't do this, or give me something else. Give me Gassanair, or give me morphine, or because you could tell that these dressing changes were just awful. And whether that's pain or whether that's fear or shock, or the cold air getting on it or something. Of course, he couldn't tell me, and that's the thing, isn't it? If you were an adult, you would be able to say, "I'm really scared," and someone would say, "Oh, it's going to be over soon," and blah blah blah, and reassure you. There's nothing you can do with that. And the nurses were lovely. The nurses were wonderful with the dressing changes. They were really trying to calm him, and they were trying to distract him as best they could. All I could do was hold him. But the doctors and I know it's because they're doctors and they just have to be really, not get involved. They just kind of looked at it, and they would kind of hold his arms out the way, and they'd be really, have no empathy about the fact that he was lying there screaming. I remember when that first dressing change, and thinking, oh shit, it's not worked. And then the doctor saying he's going to need a skin graft, and me thinking, oh my God, another operation, having to go onto general anaesthetic again. And then they described how they would do the skin graft and taking the skin off his leg and stretching it out. And I think my brain kind of just shut down at that point, and I'm just like, yes, okay, I just can't, and off he went. So he had the skin graft, and so he came back from that surgery, and he was like the most drugged up child I'd ever seen. And I remember they had the oxygen mask over his face, and he had this SATS monitor going, which he hadn't had when he came back from his first operation to clean it and put the BioBrain on. And I was like, oh my God, he's like
more sick.
Really sick. And of course he had to be on this SATS monitor all night, and it's constantly going beep 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 beep, because you know, he didn't want it on. And him coming out of that anaesthetic was horrible. I had no idea what it was like for a child to come out of anaesthetic.
So the first time he'd woken up quite...
The first time he was... Yeah, I remember that day that he had the burn, and he had it cleaned, he had the BioBrain. He came out of the anaesthetic and he seemed fine. That afternoon we were playing in the playroom. He was toddling around. He was, you know, walking on this leg that he had burnt, playing in the playroom. So, you know, that kind of contributed to me thinking, oh, you know, this isn't...
The second one was almost...
the second one after the skin graft. But of course, when I think back, it probably was a worse operation for him, because he had skin taken off. So he had a dressing that was really raw. And then he had this, I don't know how they put it on, like stitch it or something. Glue, something like that.
They kind of vary,
So, you know, it probably was a worse surgery, and he probably was under for longer. So, coming out of it was worse for him and for me. And, not nice.
No.
Not nice. We went home on the Friday. The Saturday night, I was kind of cleaning him, because his burn was really near his nappy area. I was trying to clean him really carefully. I was thinking to myself, he smells a bit funny. He smells like cheesy crisps. And my mother-in-law was staying with us at the time to give us a bit of help. And I remember we were like properly sniff. Our nose was like right on the dressing, and we were kind of like, I don't know. And then the next day, I was thinking, it smells a bit cheesy. So I remember I rang the ward, and I was like, oh, it smells weird. So they just told me to come in. So we did. That was fun. And we went again. Off came the bandages, and it was, oh God, it was absolutely disgusting. It was it was grey. Oh, it's horrible. Like grey, glistening ooziness. It was the most horrible thing I've ever seen. And I can't remember who did it. The nurse, I remember she looked at it and she went, you're not going home. And I was like, I kind of, and my mother-in-law was like, oh, are you okay? And I remember saying to her, I want my mum. Because I just thought, oh God, we're back again. But we went back into the same room. Which in a way was nice. I knew there was a bed. There was a bed for me. There was a cot. I knew where things were then. I kind of knew that I'd worked out that how to go upstairs and have a shower and make myself something to eat and things like that, which when you first are there for a bit, you don't know. But I still always like, don't want to be here. So, but I think they left it, and then the next day did a proper clean. The graft hadn't taken. Basically, he was too wiggly. He, you know, you can't make a child like that lie still. So the graft had obviously slid all over the place. Oh, he must have had to go to surgery, because they must have had to have taken it off and cleaned it up again. But I think this time they didn't put anything on it. They just let it heal with, you know, a dressing. They explained that to me. And I was like, oh, the skin graft wasn't taken. Oh, great. We stayed then, I think, in the hospital for another week. And it came towards the end of the week. And he was having yet another dressing change. And one of the doctors, I can't remember who it was an older bloke. He was actually really nice. And I was like, I want to go home, but I also want to stay because I'm scared. And he said, well, you know, we want you to do what's best for you. So if you want to stay in hospital, you stay in hospital. And I thought about it, I was like, yeah, I'm not sleeping here. And he was losing loads of weight. They had to put an NG tube down, which that was the one thing I couldn't stay. Like everything else, all the dressing changes, the taking blood, the taking him into surgery, I stayed with him for, but putting the NG tube down, I couldn't stay in the room for that. I just had to leave. And we'd had the whole hideousness, one hideous night of his NG tube with the whatever, the feed or whatever going through, and then they had to flush it through. And then an hour later they came and did some medicines, and then an hour later they did something else, and then so it was like a night of hour after hour being woken up, and I thought, I can't do this. So I thought we just have to go home. It was very scary going home. Yeah. Really scary. Yeah. Especially all the medicines, having to force them down him. There was pain relief, and there was gabapentin for his itching, and there was antihistamine for the itching. And actually that first night we were home from hospital, he woke up and he was screaming because he was in pain. And of course in the hospital they're able to give you Oromorph. Yeah. And I rang up the out of hours doctor the next day and I said, you've got to prescribe me this because he's in pain, he cannot sleep. So we went to the out of hours doctor and they prescribed us Oromorph. Thank God. Yeah. I don't know whether they were allowed to do that, but they did. And we were able to give that to him when he seemed like he was in pain because it really helped. And then we started running out of our gabapentin, and I remember I went to my doctor and they refused to prescribe it, and I had basically a stand-up row with the receptionist saying, you have got to prescribe this for my child. And they prescribed it that one time, and then the next time, every single time I had to ring up the hospital and get a doctor's prescription faxed to the chemist in order to do it, which was such a bugbear because he went through this medicine in a week. So it was literally every week to 2 weeks I was having to think, I've got to do this, I've got to get that medicine, I've got to get this sorted, because I always thought that no way do I want this to run out. I don't want him to be in pain, So that was tricky when we were home. But it was good to be home that second time. I mean, I was a bit of a maniac for sniffing because I was sniffing his dressings and thinking, does it smell all right? And but it was good to be home because, of course, the doctors were like, you've got to fatten him up. I was like, no, eat the cheese. He was literally eating anything that you could get down him. Yes. So we'd been home, I don't know, a week or two, and they looked at it. They looked at his scars and they kind of did the, it's not looking good. And I thought, well, what are we meant to do? And I remember them saying, if it doesn't start healing within another 2 weeks, he's going to have another surgery. Right. And me thinking, I don't know how I'm meant to. What you can do. How am I meant to help him? And so they were saying, he's got to have good healthy food and sleep and all this, that, and the other. And I was like, well, I'm trying, but he doesn't. He's lost that wanting to eat. Nobody wants to eat in hospital. No. And the food in the children's ward was lovely, but he just didn't want to eat it. No. So we got home and I was like literally putting butter in everything just to fatten him up to try and get him to heal, which thankfully he did. Good. Pressure garments. We had the most loveliest nurse who used to come out and do his dressing changes. I can't remember her name, but she was so lovely. She was wonderful, and it was it was really nice to have her. She would come out and she would bath him, which was obviously really horrible for him still. And she would do his dressing changes, and each time she came she would be really reassuring about how you could be like, I'm doing this, and she'd say, she'd be reassuring about the things I was doing, and she would say that she could see changes because of course we couldn't see any changes. We were seeing it all the time. And then after a bit, she was going, okay, you need to start doing the dressing changes yourself. And I was like, So I did. I've got to do it. Someone's got to do it. It's going to have to be me. so that's what you do.
Yeah.
And then he just moved to like little bandages, and I remember her then, this nurse coming, she was like, yeah, he doesn't need these bandages anymore. Or he had just like a really thin, almost like a plaster, but not a plaster, just something very soft and adhesive, and you just put a little thing over the top, and each time it seemed less, and I was thinking, this is a bit weird. It's not healed. It's not healing to me. It was still like, ugh, disgusting.
Right.
You know, this horrible red, raw scar. I mean, it was obviously not bloody and oozing and open wounds, but it was still really horrible. And I remember her saying, okay, you're going to move now to go into the outpatients for every other month. And I was a bit scared about that, because she'd been coming, I mean, at first it was like, she must have been coming every week, and then it must have been every other week, and then it must have got bigger, the duration.
Yeah.
I can't remember. And then we went for our outpatients appointment, and they measured him up for his pressure garments, and they explained about them, and then he got his little suit. And he was fine. He was fine with it. He was absolutely fine. It helped a lot with his feeling uncomfortable.
Right.
It really did. And you know, we kind of made our peace with it, that you just have to, he never ever sort of questioned it. You just were like, this is your special suit. Okay. And on it went. He just wore it. You just put it on him, and you said you've got to keep it on. And there it was. It was on. Yeah. A year and a bit he wore his pressure garments for. So he wore a full-on vest on these trousers. And then it just, no, he kept wearing those. We tried this weird little leg stocking. It didn't work. It just kept falling down. And he wore those. And then finally we had our outpatients, and they were like, oh, he doesn't need pressure garments anymore. You're like, are you crazy? It's like, how is it possibly gonna, I was like, are you sure it can't get any flatter? You sure it can't get any paler? She's like, yeah, I think it's as pale and as flat as it's going to get.
Right.
And then he just had silicone treatment. I was like, when do they know when to stop? Because to me, that doesn't look anywhere near healed at all. But obviously they do know. Oh, he had like a silicone insert under his vest, and he had a little piece of silicone that he used to wear under his shorts. And so then when they stopped the pressure garments, it was silicone it was a silicone cream that we used to rub on. Yeah, so I was just like, how is this going to work?
Yeah.
Really, really sceptical, but it has. Yeah, he's still got the scars. We kind of stopped using the silicone for a bit. When our last appointment, they were thinking, you know, I always felt they were a bit like non-committal. I'd be like, well, how long does he have to wear them for? We'll see.
Yeah.
You know, I can understand why they say that. And then when it came to the silicone, they were going, oh yeah, I think you can stop using the silicone now. But I was like, but how do I know?
Yeah.
They're saying, well, when you think it looks like it's not going to get any paler, like, I don't know that.
Yeah.
I've got no idea when it's going to look any paler. But it was only on our last appointment, which was ages ago, that they suggested take a photo and then you can compare it. And if they'd said that, I wouldn't have wanted to take a photo when it was hideous.
Yeah.
And I know they took photos when it was really disgusting. I don't ever want to see those.
Yeah.
But if they kind of said, when he first started wearing the pressure garments, you could take a photo and then you can see how it changes. Because when you see it day in, day out,
you can't see it.
It doesn't change. It really doesn't. And it's only people like, you know, my mum and dad will say, oh, you know, his scar on his leg's looking really pale. You'd be like, is it?
Yeah, I suppose they've got a period of time.
Exactly. They have a longer time. So when they said to us, oh, you can stop using the silicone, I was a bit, okay. But we've started it again because I noticed it was getting a little bit red. Just a little bit. But I can tell that it's changed.
Yeah.
But the chest one is okay. It's not great, but it's not hideous. The leg one is, we'll put we've made our sort of peace that he's probably going to need surgery to open it up and flatten it.
Right.
Yeah, but I mean, I said to the doctors that it's not a decision I want to make for him, because he's already had 3 surgeries where I made that decision for him. We talk about it. We talk about how he got his scars and how he poured the teapot over himself, and he talks about his scars, because we try and say, you know, if I've got a cup of tea, I'm like, oh, you know, this tea is hot, what happens if it goes on you? And he'll say, I get scars. He doesn't understand burn, but he understands he'll get scars. But he's always been really good about, he's not self-conscious about them at all in any way. Like, he would have been about 2 and a bit, 2.5, and we would go swimming, and this other little girl toddled up, and she kind of pointed. You could see her like that, and you could see her mum thinking, oh my God, she's doing this. Yeah, exactly. Yeah. But she kind of did that. It's my scars. Do you want to see? And he pulled up his shorts to show the other one. This little girl's looking at it going, oh, and I said, oh, tell the little girl what happened. He said, I poured tea on me. These are my scars. And she touched them. I said, look, feel them, they're really soft. It's always adults and parents who are worse when they see it. The children are fine. They're
just curious.
They're just curious. They just want to know what it is. And if you tell them, they're like, okay. And that's it. I'd rather people would just say, oh, what's happened there? And you can either tell them to bugger off, or you can actually tell them what happened. He's like any other 4-year-old. Like any other 4-year-old. And I just hope that, you know, his scars, he doesn't, I can't think of the word, it affects you cosmetically or whatever, you become aware of them. And that's something that's kind of harder, because people who don't know will just go, oh, he's a boy. He'll just say he got bitten by a shark, fought off a dog, this, that, and the other. And you're like, but you don't know how he's going to feel. You don't know. So I hate it when people try and brush it aside. I'd much rather people said, oh yeah, it doesn't look very good. It's not a nice scar, but he's not bothered by it. So we'll just see how he goes. You know, I've never liked it when people try and minimise something. I'd much rather they listen to what you're trying to say, which is, I'm scared of how he is going to feel and how other people are going to react, and they just accept that and say, well, there's nothing you can do, you just have to see how it goes. And I suppose the good thing about this burn injury is that it doesn't get any bigger. It's going to stay the same size, whereas his body will grow. And so at the moment, well, I mean, when it happened, it felt like it was over his entire chest. Now it's a much smaller portion, and hopefully as he gets bigger, it will be not quite so noticeable. Yeah.